Today I wanted to talk to you about the Medicare Overcharge Measure, Medicare excess charges, and how that may relate to the Medicare supplement plan that you choose. So a Medicare excess charge, what this is, if you happen to go to a doctor that does not accept Medicare assignment, that physician is allowed to have what's called an excess charge. And this excess charge would be an amount that is above and beyond what Medicare approves for a specific service or procedure. Okay, so basically Medicare is a big book of each and every imaginable procedure, okay, and what the usual and customary cost is to perform that procedure. So if we go to a non-participating provider or a provider that does not accept Medicare assignment, in that situation there could be balanced billing. And so what that means, let's say for example the doctor decides that a $400 payment is not enough. So in that situation, that doctor can bill in excess of 15% of what Medicare would have paid for that service. So in this example, that excess would be $60. The $60 in turn would be balance billed to the patient. Okay. Now, if you do go to a doctor that accepts Medicare assignment, then they'll accept 100% what Medicare considers to be usual and customary. So in that situation, you will not be balance billed. Now, there are two Medicare supplement plans that do cover excess charges, those plans being Medicare Supplement Plan F and Medicare Supplement Plan G. Okay, so that could still shield you from ever having to pay excess charges. Okay, and there's also a law that was passed that's called the Medicare Overcharge Measure. Okay, and there's 8 states where Part B excess charges are not billed. And those states are Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. Okay, so in these states, if you reside in one of these states, you will not be balance billed for excess charges. Things to consider when choosing a Medicare supplement plan is obviously the state that you reside in, also the state that you may reside in the future if you have plans to move, and also the state that you elect to seek care in. So one thing about the physicians that are billing excess charges, the statistic that comes out from 2016 is 4 to 5% of physicians billed excess charges, which is a low number. We could see that number rise in the future as reimbursements to physicians continue to decrease as well. Any questions on this topic? Please reach out to us. We're more than happy to help. We hope everybody out there has a great day.